thank you all for coming. My name is Ethan Rarick. I'm the director of the Robert T. Matsui Center for Politics and Public Service here at Berkeley. I appreciate your coming out on such a nice day. It's wonderful to see a great crowd like this. This is the second annual Matsui Lecture and is one of the flagship events of the Matsui Center, which we established about a year ago as a component of the Institute of Governmental Studies here at Berkeley. The purpose of the Matsui Center is to interest and engage Berkeley undergraduates in politics and public affairs and public life through a variety of programs, including internship programs, and through the presence of distinguished visitors on campus, such as Congressman Fazio. The Matsui Center is a memorial to and a legacy of Robert Matsui, who served in Congress for 26 years, representing the city of Sacramento, and was a Berkeley alum, and one of the most distinguished public servants, a bipartisan public servant in California politics and public life. I want to acknowledge the support of two current members of Congress who have been very supportive of all of our efforts. One is our local member of Congress, Barbara Lee. Congresswoman Lee was the sponsor of the legislation that helped to establish the Matsui Center, and we appreciate all of her support. And I particularly also want to acknowledge the support of Congresswoman Doris Matsui, Bob Matsui's widow and successor in Congress, who was also instrumental in establishing the center. She donated the congressman's papers to the Bancroft Library here on campus. Those are now being cataloged and will serve as a future reference for researchers. And throughout all of our efforts over the last year in establishing the center, Congresswoman Matsui has been incredibly supportive, and I want to thank her. I also want to acknowledge the fact that we have two of her staff members from her district office here, Nathan Dietrich and Ann Sanger. Thank you for coming, and please pass along to the Congresswoman our appreciation for all that she's done. A brief note about our internship programs for the students who are here. I hope you'll go to our website, which is politics.berkeley.edu, and get a little more information about those internship programs. We provide scholarships for students who are doing the UC-DC program to help offset the extra costs of going to Washington, D.C. We have a summer internship program that we run ourselves in Sacramento, Cal in Sacramento. The deadline for applying for that is coming up shortly, but there's still time to apply. And we have a local government internship program that allows a student each summer to intern in local government, a mayor's office, a city council, that sort of thing. And that deadline is not until January. So for students who are here, there are some flyers at the back of the room on those programs, but I hope you'll go to the website as well, politics.berkeley.edu, and learn a little bit more about our internship programs. A couple of logistical notes, and then let me introduce today's speaker. After Congressman Fazio is done speaking, we'll have time for some Q&A. We're going to have a mic that comes around, and please wait for the mic to come around. We're recording this for webcast later on our website, and so we'd like to be able to hear the question as well as the answer, so we'll bring around a microphone to you. And then after that, after we're done, we have some refreshments at the back of the room, and I'd invite you to join us for a brief reception. The congressman can stay, and you'll have a chance to ask questions if you didn't get called on during the Q&A, and just chat with him a bit. This program, the Matsui Lecture, each year brings to the Berkeley campus a distinguished former member of Congress for a one-week residency, during which time the member has a chance to speak to classes, to seminars, to meet with students, to avail himself or herself of the campus resources, and also to deliver this public lecture, the Matsui Lecture. Last year, the inaugural Matsui lecturer was Jim Leach, who did a wonderful job, and this year we have an equally distinguished speaker in Vic Fazio. In your program, which I hope most of you picked up from the back table there's a more extensive biography of Congressman Fazio, so I will keep this brief. He is a graduate of Union College in upstate New York, came to California and began his political career as a Hauer Fellow, then went to work for the California Legislature, including working for the then Speaker of the Assembly, Bob Moretti. He also has a background in political journalism, interestingly enough, and I don't know if he's going to talk about that, but you could always ask him about that in the Q&A, I suppose. He was a founder of California Journal, which unfortunately, as many journalistic organizations eventually had trouble and gave up the ghost, but for about 30 or 35 years, I suppose it was one of the most distinguished sources of information on California politics and policy. And Congressman Fazio was a founder of the California Journal in the late 60s. He began his career in elective office in 1975 when he was elected to the State Assembly in a special election, and then in 1978 was elected to Congress, representing a district that included parts of Sacramento County, parts of Yolo and Solano County. Through the years, his district changed a little bit with redistricting, but it included many parts of Northern California, eventually reaching well up into the northernmost reaches of the state. He served in Congress for 20 years, from 1979 until he retired in January of 1999, following the 1998 election. During his tenure, he was a member of the House Appropriations Committee, as most of you know, one of the key committees in Congress. He served as a subcommittee chairman or a ranking member for 18 of his 20 years in Congress. He was also on the Armed Services, the Budget, the Ethics, and the House Administration Committees. And he rose in the Democratic leadership of the House, serving as vice chair of the Democratic caucus, and then filling two of the most important leadership roles in the Democratic leadership, serving as chairman of the Democratic caucus, the third-ranking position in the House leadership, and as chairman of the Democratic Congressional Campaign Committee, which runs Democratic congressional campaigns. So he played a key role in the Democratic leadership both within Congress and in the operation of political campaigns. He's here today to speak about a particularly timely topic, which also will allow him to draw on his long experience in Congress, how Congress works, lessons from the healthcare debate. Congressman Fazio.
Thank you very much, Ethan. I want to thank you and Jack Citron for making this such a pleasant visit. It is a lovely visage here. I mean, you can see the entire Bay Area. And if you get bored, I wouldn't mind if you started daydreaming out the window. It would make me feel much better about the time you're devoting. I want to say, first of all, how proud and pleased I am that I can follow in Jim Leach's footsteps, a really wonderful member who President Obama has appointed. We were arguing yesterday whether it was the humanities or the arts that he is heading the National Endowment of, but he is a truly great individual and an appropriate person to kick off this series of Robert Matsui lectures. I'm really pleased to see Ann and Nathan here. I hope you'll pass on to Doris just how pleased I am to have this opportunity. You know, Bob and I were elected together to Congress in 1978, and we were awfully good friends. You know, for 20 years we served right next to each other. I used to laugh and say, he's the city mouse, I'm the country mouse. Because I was always outside of Sacramento with some major suburban areas. We had an awful lot of overlapping friends, and the good news is on most issues, even though we had rather occasionally different constituencies, we saw eye to eye and worked very closely together. Stan Hazelroth, who's sitting between the Matsui staffers, was my district director for a while and is now the head of the State Infrastructure Bank in Sacramento for the state of California, a prototype, we hope, and Stan is doing his night job and making it a prototype for the nation. Because in a place in time where we have about $2 trillion of unpaid bills in infrastructure, and we can't even add a nickel on the gas tax, we have to come up with some new and innovative ideas, and hopefully Stan is on the cutting edge of that. You know, one of the people who I'm sure most of you don't know that I go back furthest with is Professor Martin Jay. Marty and I were both students at Union College in the same 4-year time frame, lived in the dormitory together for 3 of those years. You know, I have to say, I know Marty wanted me to come down here probably a decade ago when I retired to speak at commencement, and I couldn't pull it off. So this is my second best shot. Thank you for coming, Marty. I'm looking forward to seeing you more before the week is over. In fact, I hope I'll see many of you in other settings before the week is over. One of the guys that stopped by to see me this afternoon is Fred Martin, who used to work for the B of A in Washington and based here in San Francisco, and knows a lot more about banking law than most anyone you could ever find. And I bet we hear from Fred later. We'll get to questions. And Peter Schrag is here from the Sacramento Bee. I don't know if it was in its heyday, Peter, but it sure was a lot better then than it is now. And we miss very much the kind of editorial touch that you provided for all those years, you and so many others. And there are probably other people here who I've known through the years, and I hope if you haven't had a chance to say hello, you will going forward. You know, Bob did not live a life that was anything but exemplary. You know, he had a wonderful career, a great family. It was a very fulfilling life for him, but it wasn't long enough. And this is really an opportunity to kind of perpetuate what Bob stood for, the principles he fought for, and the principled way in which he did his job, in conveying down the corridor of life how much value there is in public service. And he and I shared a similar interest in that. And I'm really pleased to see so many young people here at the university and throughout the state who can do much better, frankly, in the future than the current leadership has been doing in the present, to try to turn this state back in the direction it had once been a leader in. It's tough right now. It's tough both in the state capital and in Washington. Rarely have our leaders been as tested. And what I would like to do a little bit of as I go forward here is sort of give you a sense of what Congress was like when I first came to work in Washington in the mid-'60s. Briefly, my congressman that I worked for had misjudged the Reagan Revolution, was still luxuriating in the LBJ sweep, and lost his office in 1966. Something that I kind of learned the hard way was never, ever be self-confident. Don't be overconfident. You know, be alert to the political challenges that are out ahead of you. I guess I hadn't learned that lesson. I wouldn't have been reelected in 1994 when I think I won with 48.4% of the vote. God bless the libertarian. So I'm here to tell you that the Congress was a different place, even in 1978 when Bob and I arrived. Certainly changed fundamentally in 1995 when Newt Gingrich led the successful Republican revolution. And it is today a very different place than it was then. And it's a really interesting, if you look at the sort of sociology of the Congress, and I'd like to do that with you a little bit. When I first came, Congress was mostly white, mostly male. The differences I think you could have almost analyzed as, well, there were Rotarians and there were Kiwanians, and there weren't very many Seroptimists. You know, they were not people who had fundamental differences, even though they had different parties. There was no Roe v. Wade and no deep cultural divide. Sure, there were people who represented urban and rural and suburban constituencies, but we were, at that time, much more likely to socialize across party lines. People would come to Washington for 6 months and return to their district for the other 6 months. Lindy Boggs, who was a great congresswoman from New Orleans, whose husband Hale had died in a plane crash in Alaska. You know Cokie Roberts from your NPR mornings. The daughter, Tom Boggs, one of the leading lawyer lobbyists in Washington. Lindy would talk about how they would socialize on weekends. You know, families would get together. You didn't demonize your partisan opponents because you knew them too well. They weren't people who were, you know, caricatured enemies, people you went up against. They were people you actually came to know and like. And that was changing even in the 70s when, you know, the Watergate class arrived with such great fanfare in 1974. Even then, given the bitter after effect of Watergate, there was still a good deal of camaraderie. More and more of it was perhaps developed on those terrible politically toxic boondoggles travel overseas. It's never popular to travel, You're always vulnerable to an attack piece in the election context. But, it really was a place where members would get to know people who were from other parts of the country, who they had probably little in common with on the surface, but they had a common bonding experience. They spent a lot of time together in a very constrained environment. They were forced to get to know each other. And frankly, it fit in with the way in which the body functioned. We had people who were called bull weevils. Those were Southern Democrats, pretty conservative. Some of them more progressive on civil rights as time went on, but most of them pretty much traditionalist on those kinds of issues. They were economic conservatives. They were planters and bankers, and they were Democrats because everybody was a Democrat, at least up through the 70s and 80s. And Republicans from the Northeast and from California even. I think of Congressman Maillard from San Francisco, one of the last Republicans to represent it. I think Milton Marks might have been another one in the state legislature. But these were people who were socially pretty liberal and often voted for things like anti-gun amendments. But they were Republicans, and they actually, in some ways, were balance wheels with these bull weevils, gypsy moths and bull weevils. Some people like that. Just kind of one insect for another. But they really did represent the diversity that the two parties at that point continued to have. And that's changed dramatically. It changed really with the passage of the Civil Rights Bill and gradually affected the people who were participating in politics in the South. We had more and more reapportionments that allowed African Americans to have districts. And normally it was done in concert with Republicans who ended up winning more of the rest that were white and conservative. Now that's begun to change back a little bit in the recent past, but it's still a phenomena through most of the time I was in Washington. And we saw most of the moderate suburban Republicans replaced with Democrats. So, the parties became far more cohesive and far more focused on their own inner agenda. In fact, it coincided with the way in which life changed in Washington. No longer were you bringing your children to Washington and going home to the district, with very little visits in between. More and more now, you were on the airplane. Whether you went every weekend or every second or third weekend probably was determined by whether or not you had a competitive district or not. You were probably on the cell phone and now the BlackBerry when you might have been conversing with someone on the House floor. You became more and more an individual political entrepreneur rather than a member of a party or a movement. You knew that if you were going to get reelected, you had to raise the money and do it yourself. The party would help, perhaps in that first opportunity to win a seat of the other party or win an open seat, but pretty much you had to learn to fend for yourself. You had to be an independent when it took that to satisfy your constituency, and a member of the party when it would only do you the most good. And so I think you saw a very significant change. One of the factors that I think people overlook, it's just not the jet airplanes and the cell phones, it's spousal employment. Increasingly, members of Congress, male and female, had spouses who worked. It was part of how you put kids through college and did all the things that the middle class was supposed to be able to do, actually the upper middle class, although most members of Congress never quite felt that way. In some districts, it was obvious you were, in many others, you weren't. But the bottom line was, you didn't pull up stakes from the district and move to Washington. Go Washington was a bad thing. Some people were talking to me yesterday about what brought Tom Daschle down in his last Senate race. And those ads of his great big house in Washington didn't do him any good at all. Because in South Dakota, he'd gone Washington. And so the Republicans played this very well in the aftermath of the Gingrich Revolution. Most of their members stayed in their districts. They shortened the work week to Tuesday to Thursday. People came in late, worked frantically, and went home. There wasn't any time to fraternize with the enemy, let alone make friends. across the aisle. It added power to the leadership. You could herd people much more effectively when they weren't getting too smart, getting too informed. They needed to hear what the agenda was, and that's all they needed to know. Stick with the program. Democrats have never been quite that easily organized. Republicans did sort of set the tone. That's how they won, by being focused and extremely partisan, willing to make a contrast with the leadership of the Democrats. And Democrats were all, in their view, alike, even though we know how diverse they were. But it was that model that Gingrich used to first win the majority and then to control the process until, like Robespierre, he went to the guillotine too and lost his speakership 4 years later. But it was that sort of approach to gaining power that, frankly, allowed the Democrats to take control not too long ago now, 3 years ago. Nancy Pelosi operates far more like the Newt Gingrich model than any of the Democratic speakers who preceded her, some of whom she's very close to and reveres greatly, because they were people who empowered the chairman. They gave power to the committees. There wasn't a great central authority, which really in some ways limited the ability of the Democrats to be a message party. Nancy learned from watching how first Gingrich and then Tom DeLay, a little bit of Dick Armey and Denny Hastert, had attempted to really bring the Republican Party to a point of most effectiveness. And it was unifying her troops, which she did so effectively. With an awful lot of love and a little bit of fear, Nancy governed effectively in the minority and brought back to power her party. But in winning the majority and then building on it, as she did in the last election with the Obama, I won't call it landslide, but overwhelming victory in some parts of the country, she was in a position to grow toward the center. And so as she's now got this tremendous responsibility of health care thrust upon her, she deals with a party that is from slightly right of center to very far left of center. And the task that she has on this health care bill that she hopes to bring to the floor this week and finish sometime next week, at least that was the agenda as of today, is a very difficult group to reconcile, to bring together. I think she will get her majority. I don't think she will get it by a very large percentage. But when the bill comes back from the Senate, whenever that is, could be in January now, because I think they'll spend the whole month of December on the Senate floor debating health care, then maybe a different mix of Democrats in the House can vote for it. But I do think she understands and her caucus understands, despite their widely varying views, that they have a must-pass piece of legislation. They analyzed their defeat in 1994 as the Democratic majority, in part based on their failure to pass health care. That failure distressed, de-inflated the Democratic base. On top of that, instead of raising the corporate tax by maybe 0.25%, we raised the gas tax back in '94. And that gave the Republicans the chance to say we'd raise taxes on all Americans. And then we made a foolish decision to tie the assault weapon ban into the crime bill and get a bunch of people from conservative rural districts who to vote for the rule that permitted the bill to come to the floor to be pillared by the NRA as having, walked away from their long commitment to the Second Amendment. So Nancy's understood that she has to bring her party together, and the best way to do that is to find something that will hold the center of her party. There are progressives who refuse to vote for a health care bill that essentially doesn't have single payer in it, and certainly can't abide a watered-down version of a federal alternative. And there are conservatives in the party who are having a hard time just voting for the bill. And let's talk a little bit about health care in the context of that time in '94 and today. I think, first of all, I've talked about the committee chairs who guided the process. Tom Foley was a great guy, great speaker, but he let Chairman Rostenkowski of the Ways and Means Committee, Chairman Dingell of the Energy and Commerce Committee, essentially decide the fate of what was ultimately a tough failure to perform. We ended up with a very difficult scenario where we couldn't even bring a bill out of committee to help with the first phase of Clinton care. It was a complete abject failure. Newt Gingrich showed us 2 years later exactly how to do it. You create a task force. Forget the chairman. You get the task force to put a bill together that was really the leadership's bill. You bring it to the Rules Committee and put it on the floor. What are you worried about these chairmen for? What are you really worried about how a committee may want to vote? If it's in the broader interests of the Republican conference, do it. Well, I think Democrats have come part way along in understanding that sometimes you have to find ways around the impediments that powerful individuals can sometimes put up that stands in the way of progress on behalf of the broader interests of the party. And so I look back now at the way in which we were organized, and I look at the way in which Nancy and Steny Hoyer, the majority leader, are functioning in the House, and I see a vast improvement. They have coordinated the efforts of 3 committee chairmen. They've amalgamated the bill into one, and it's on the floor. Took a while, but it wasn't a product of an Ira Magaziner backroom sort of think tank that brought out a bill and slapped it on the desk where it was dead on arrival. It really was the product of a lot of tug and pull in the legislative process, which I think has been one of the weaknesses in some ways, but more importantly, a strength in that it does represent the will of the members of the caucus. And I say just the caucus because Republicans have been totally disinterested. I should have said at the beginning, I try to be objective, and occasionally I show my partisan side. Republicans have taken on the Reagan mantle here, and I don't mean Ronald, I mean Nancy. Just say no. And it really has been their watchword on almost all of the major bills this session. Republicans are not really interested in seeing the Democrats succeed. And I have to say, the Democrats took the same approach when it was the Republicans who felt they had to pass a pharmaceutical benefit bill. They had to do it in the worst way, and they did. Remember, it was 3 hours when the roll was open on the House floor. And they passed it because they had to. They'd promised their base. The senior citizens continue to kind of lean Republican in this country. They certainly are the biggest opponent to health care progress this year on average. They don't want their Medicare cut, even though Republicans have been saying for years we have to reduce the cost of Medicare. This year they're running ads all over the country, not here because it doesn't do any good, but in most red states saying they're going to cut $500 billion out of your Medicare. And so the seniors tend to be opposed. We also have a difference in the media these days. In those days, we still had a lot of opinion-making editorial pages. We had a lot of in-depth coverage on health care. You really have to struggle now to find a Robert Pear at the New York Times or some of the others who cover health care in a knowledgeable way. I mean, there are a few in public broadcasting, but today it's very superficial. Most people get their information out of advocacy media, whether it's the left on the blogosphere or the right on talk radio and the right on Fox and the left on MSNBC. We all go where we have to go to get people who tell us what we want to hear. And we even live in communities where we don't have to find too much difference of opinion with our neighbors. We sort of self-select in this society. And so we are warring camps, lobbing rhetoric back and forth, and our political leaders who like to raise money online and in telemarketing play right into that. It's not conducive to getting compromise or getting consensus in the broader body. Right now, I think Democrats would be happy enough to have it within their own caucus. We had Harry and Louise, though. And today, television spots are still most important. Harry and Louise have shifted sides, by the way. They were a major problem last time, even though they didn't get a lot of exposure. It was the free media that picked it up. Remember, there's got to be a better way, they said, which is to say, not this, something else, but not this, but nobody ever gave them the alternative. There wasn't one. And there hasn't been one during the remaining 12 years of the Republican majority. Today, they will advocate giving everyone a tax credit to go out and buy a health insurance. Of course, forgetting about whether you have a prior condition or a chronic illness or what have you. There's really no alternative to whatever the Democrats can come up with other than no. And the media is playing into that. I mean, we had a summer not only of, contentious town hall meetings that were chronicled on cable, but we had television ads pounding away on the cuts to Medicare. The death squads, remember? The people who were going to pronounce thumbs down on grandma. Nothing to it. In fact, a Republican senator from Georgia had wanted to make mandatory something that the Democrats said should be optional, and that was to reimburse a physician who responded to the request of a patient's family to discuss end-of-life procedures. That became, they're out to kill grandma. We're going to take care of all the illegals. Well, illegals will get cared for, but not at federal expense. It will come out of the local taxpayers or the other insurance payers. But today, we all pay about $1,000 more on our family policy, covering the uninsured. So this wasn't just about the moral imperative to be the last industrialized country in the world to cover everybody. It was an economic incentive, not just to try to reduce the overall cost of health insurance for all of us. It was also, really, frankly, to bend, as you've heard, the cost curve. How do we cut the cost of health care, which is blown through 20% of our national economy and continues to go forward, while we still have really pretty pathetic health care indices. If we look at the degree to which we take care of our people in this country less effectively than many of the other people who are nowhere near as affluent, but do a better job of getting care to all corners of their society. There's no question that the deficit, it makes things much more difficult today. Everything that the president proposed has to be looked at in the context of out-year expenditures. We all know in the short run, economists from one end of the spectrum to the other, that we really do need to be priming the pump and building on the supply side, getting the economy going again. At some point, and this is the debatable one, we need to begin to shut down on federal spending and bring our percent of GDP for national debt down to something in the historic range, or maybe 1% to 2%. And this is not just a nice thing to do because it makes us feel better, although it does. Most Americans are hoarding cash and sitting on their money right now because they have the same need that the government does. Of course, that's a little bit detrimental to kicking the economy into gear, but it's a human instinct. And there is, just as there was in the Roosevelt era, a pressure on Congress to rein in spending, perhaps prematurely, perhaps counterproductively. But it certainly colors the debate on health care. And so there's a tremendous amount of pressure to raise the revenues and to cut the spending in the internals of this bill so that if it doesn't reduce the deficit, certainly won't expand it. And there is hope that there is some fundamental reform in this. It doesn't get a lot of discussion. But physician groups, which we know well in California, with capitated programs, cut health care costs. The Medicaid costs in California, Medi-Cal, are half what they are in New York State, because there they rely on fee-for-service. And here we often give that care in groups that drive down the cost. People at the Kaiser Permanente groups are aware of how that capitation has worked for those like me who've been in that program for some 40 years. So there is a lot of different economic environment in which we have to work this time around. There is one constant, though, employer mandate. Bill Clinton, Hillary, and the current administration have concluded that building on the existing system of employer coverage is the way to go. It's easy to say that, but it gets much more complicated. Do you mandate coverage? And if you have the refusal of the, say, small business entity to provide it? Do you make them pay a fee? And how big should that fee be? If you are going to set up a federal alternative, does that suffice as a place for the small business or the sole practitioner to take their health care in order to get insurance that would be perhaps competitive with a large corporation could obtain for their broader workforce? Can you somehow blend in enough people in that form of employment that you can take the sting out of some very expensive health care requirements that can blow up the plan for a small business? Somebody's very sick, it just raises the rates on everybody. So a broader insurance exchange, which this bill contains, and a alternative that will be there for people who otherwise fall through the cracks. And then, of course, do we incentivize individuals to sign up for that? And if we don't incentivize them enough, will we still cover enough? Because even the best estimates are that we're still going to leave a certain percentage of people in this country uncovered, at least initially. So it's a very, very different bill than the bill that we attempted to pass and got very little traction with back in 1993. But in a fundamental way, it does continue to base the employer as the centerpiece of coverage in this country. What it really tries to do is to give employers, whether they're self-insured or whether they contract with health insurers, profit or nonprofit, an opportunity to improve the benefit package they offer, and hopefully at a declining cost going forward. Now, I did want to take questions, and I know a lot of you probably would love to participate. I hope you'll take me in some new directions, and I hope at the same time you will challenge perhaps some of the things I've said. I don't even know it anymore when I shave the truth. I try not to, but occasionally it's just instinctive. So I guess what I would like is a little interaction with you on healthcare or on the Congress, the kind of people who are showing up there. It is a much more diverse institution, much more like America. And because America doesn't talk to each other very effectively, we ask our members of Congress to do it. And it's not all that easy for them either, because they come with all the biases that we have, all the prejudices, all the instincts, and occasionally those clash across the aisle, within the caucus, in conference. So, we, I think, sometimes denigrate our elected officials. There are those who fail us and those who really aren't up to the challenge. But it's amazing the number of people who rise to the occasion, who show courage, who are principled when you could find it so easy for them to give in to, whatever the popular view of the moment is. And they come in all shapes and sizes these days. They are more and more reflective of the kind of community we have in California, let alone the country. And so I leave for a moment here with those thoughts, because while I don't look back with a desire to serve once again, I do look back with tremendous pride and satisfaction and real recognition and respect for the people that I serve with by and large, and the people who have continued to come after. We have avoided what I believe is a plague in Washington, term limits. The average member only serves probably 6 to 8 years at best, and people only focus on the people like John Dingell who've been here 50 years. They don't understand that turnover is the norm, and there are an awful lot of new people coming in the door 50, 60, 70, almost every term. But the quality of people continues to be high. They are not all in sync on ideology, but increasingly really prepared in their life experience. It's no longer only lawyers need apply, to really represent the diversity of the country. So with that, I'd love to hear what's on your mind. Thank you very much.
I think somebody over here had their hand up. Was there somebody on the right here? There we go, that young man right there.
Congressman Fazio?
Yeah.
I'd be curious to hear about, when you first considered running for Congress, what would you say was your primary motivation? What were your reservations, and what advice would you give to young people thinking about doing the same today?
Well, I think the most important thing you need to decide you want to aspire to public office is to have a motivation, not just to public service, to problem solving. The best people that I've served with are people who started, fairly low down in the system and worked their way up. Served on a school board, served on a city council like Bob Matsui, found a group of supporters in the community, worked on issues they cared about, and that naturally carries you through the political system. There are various forks in the road. You either make a career in Sacramento or go to Washington or stay at the local level, whatever it may be. Those forks will present themselves and you make a call. But I'm a little bit skeptical of, and Marty will laugh when I say this, the student body president, because I was one, who kind of enjoys the elixir of leadership, because there's got to be more to it. You got to be motivated to do something for people. Always a mix, People without egos don't often run for office. But it's got to be in check. It can't be the motivator. And I ask somebody, what do you want to do? And they have nothing to say. It doesn't work. I'll never forget one of the greatest senators ever to serve, Ted Kennedy, responding to Roger Mudd when he was running for president against Jimmy Carter in 1980, and he couldn't really tell them why he wanted to be president. And I think in his case it was because it was sort of what you do when you're a Kennedy. But he wasn't able to get beyond that personal instinct to follow in the footsteps of his brothers. I think a lot of people gave him a pass. But I don't give passes to people who can't really tell me why they want to run for office, other than they think, gee whiz, that would be fun. So there are lots of ways to do it. I was going to go in the Peace Corps, and I couldn't get in because I had asthma. So I ended up going to Coro, and that took me in another direction here in California. But you can go into Teach for America and decide you want to be a school administrator. And then run the schools in Denver, Colorado, and get appointed to the Senate, like Michael Bennett. That's not a bad way to go. We need people who understand all of the complexity of American life because they've experienced some of it. We have a guy named Larry Kissel who is a congressman from the center of North Carolina. He was a teacher, but before that he was the foreman at a textile mill, and it's all gone now. He understands what the people of that part of North Carolina are all about. And that's really what we need. People who are community organizers, like our president. People who are not necessarily to the manner born. We still elevate a lot of those kinds of people, and they are often very public-spirited. And there are people who we politicians refer to as self-funders, who the party will often put forth because they can bring a lot of money to the race that the party doesn't have to give them. And some of them work out. Some of them were the people who the family really wanted to get out of the business, because they were driving it into the ground and wanted some real management to take over. It depends. But there's no one background that I look down on. We need people who've run a business. We need people who've been academicians. The guy that took Jim Leach's job was a professor at Cornell College. And he had came up to me one day and he said, "You owe me." And I'm used to people asking me for money, but I wasn't really convinced that I owed him anything. He said, "Yeah, I got my PhD at Davis and I walked precincts for you back in 1983. So I think we need all kinds of people in Congress. And we certainly are getting much more gender diversity. Not only are we having an awful lot of women elected, we have a lot of gays and lesbians who are running and winning very overtly. It doesn't happen after they retire, So I think we're getting where we need to go, but we continue to need as much diversity as we can get. That's a long-winded answer. I hope it helped. Peter?
You talked about the increasing diversity of Congress. Are you talking only about the Democrats or also about the Republicans?
I think I'm mostly talking about the Democrats, but I think it's happening to the Republicans too. We have the first Vietnamese American elected kind of in an upset in New Orleans. Democrats were divided between the supporters of the kind of disgraced Congressman Jefferson and others. But I think you're seeing more women in the Republican Party as well, not as dramatic an increase, but more. And I think if they move back toward the center and take a larger swath of Congress, as inevitably they probably will, they will probably be more diverse when they do that. There was a real effort, as you remember, to work closely with the Latino community. And I think that has largely failed on the part of the Republican Party, even though President Bush was an advocate for it. And even the kind of political, thinkers like Karl Rove bought into it, because the political base of the party was so anti-immigrant that it simply wouldn't allow a John McCain, George Bush immigration reform policy that Nancy Pelosi could support to even be considered. So they have set their cause back. Pete Wilson did it in California, and Republican Congress did it in Washington. And I think the Latino community, in all its diversity, and it's extremely diverse, is far more oriented to the Democrats today. Florida Democrats are now carrying a majority of the Hispanic vote in Florida. And that's because younger Cubans are voting differently than their parents, and because there are a lot of other Latinos in Florida who didn't come from Cuba. So I think the Republicans have really hurt themselves in that regard. Yeah.
Congressman, how do you believe that campaign finance has impacted the healthcare reform package as it's being moved through? And how do you see that in the broader scope of Congress changing over time?
Well, I personally am for public financing, and I'm going to be public about that. And a lot of Democrats who lobby like I do are going to join me. And it isn't just in our own self-defense. We're tired of people calling us for money. It really is because the whole fundraising thing in Congress has been so all-consuming that there really isn't enough time to do the job. I'm not one who runs around saying how corrupt it is and therefore we have to do away with private giving. I think it is simply a distraction that is taking people away from their job. Anytime the Congress is in recess or having a long debate without any votes, my phones light up like crazy because they all went over to the campaign committee and got on the phone. Now, I used to demand they do that when I was campaign chairman, and they never listened to me. And now I'm getting the other side of it, and I'm not happy about it. But what is more a factor in health care reform is the dollars that are being spent on television, not by candidates, but by the interest groups affected. And this is an interesting point. In 1993, almost all of the groups, provider groups and others with an interest in health care reform were against it. The doctors didn't buy it. The pharmaceutical industry opposed it. Health insurers who hired Harry and Louise went ballistic. All of that brought down the bill, along with a lot of small business people who just simply didn't want to have to cover their employees, couldn't figure out how they could afford it. Whether they could or not, that's how they felt. This time, Obama said, I have got to neutralize those interest groups. Now, the Chamber of Commerce is taking a lot of money, much of which is not visible to the general public, and spending a lot of money on ads, and other groups allied with the Republican Party are, and some renegades, a guy that owned a health insurance company and made a big bundle, is out there trying to preserve his nest egg. But by and large, most of the large interest groups have stayed out of the fight. In some cases, they've even done some tacit support for passing a bill, not always in great detail, but wanting to see this process move. And that's happened for several reasons. One of which is, most people who knew anything about health care just thought the existing system was unsustainable. I talked to a good friend of mine I serve on a board with who's chairman of a major biotech firm in this state, and he said, you cannot rein in costs as long as your incentive is always to do more. Not to do well, but to do more. The more you sell your time, your product, the more you make, and you're rewarded for it. That is a perverse system. And so most of these people said, we've got to do something about it. Now, the biggest conundrum here is, in order to keep them in neutrality or support, they were willing to take cuts. And those cuts were balanced by the additional market they were going to be given. You know, you could cut your costs of pharmaceuticals, but if you had another 45 million people to sell them to, it would come out even, in theory. That was part of what this was about. But as the cost of the bill has become so important, and the way in which you mandate coverage has gotten so contentious, employer mandate, penalizing or incentivizing individuals, the number of people covered has declined. And that's when the health insurance industry, for example, spoke out almost at the last minute and said, rates are going to go up for everybody if you do this federal option. They had heretofore kept their counsel. So, you know, in some perverse way, the interest groups in the healthcare field have been pushing for more coverage, universal coverage, because that's the way they could rationalize participating going forward at reduced costs for the rest of us. Health insurers want to cover more people. The more people they get, and they're largely healthy people, young people, some of you in the room here, feeling your immortality, figuring you don't have to get coverage until you've got kids at 32. And you fall off your motorcycle and you go to the emergency room, and who pays? The people who are 62, 52, 42, and 32, not you. So, you know, there is this need to get the healthy people into the system contributing for the day in which they get sick, and not just joining the day they get sick. That's what this is all about. So I think in a funny way, the people who have been most heroic in this are the people who are willing to accept cuts, knowing their profits may be reduced, but who support, if not universal coverage, the broadest possible. This gentleman, Fred, over here. I knew Fred would have something to say. I didn't see anybody else, but maybe it's the light.
Vic, you talked about employer mandates as the key to the health bill, and I think that makes a good deal of sense.
It's a big corporation thing that we want to bring to everybody.
Well, I think that's right. Certainly those some of those executive pensions and things should be curbed. But when you talk about that, a lot of the complaints of particularly the manufacturing industry is that their legacy costs, their health care costs and other things, their pension costs, are what deprive them of competitiveness in the international environment.
Right.
How do you square that? And looking at the Medicare problem and Social Security problem, the fiscal problem.
The pension problem, too.
Yeah, and the pension problem. How do you square that? And what's the best solution to making that workable for all?
Well, I do think that we should restrain the cost of health insurance. I'm a believer that to the extent that we can raise money in the health insurance system to pay for this bill, we should. I do think it's unfortunate because since World War II, a lot of people in this country got their increases in pay through the health insurance system, with a tax deduction. So it's got the system a little out of whack, to be frank. But we have to rein that in, for one thing. Many of those people who are upset about, say, Medicare Advantage being cut are people who really had kind of a gilded system. You know, you got your gym dues paid for. And it's great, but it was running at about 118% of what should have been 100% in terms of the kind of contribution that we make toward health care coverage for most people. So clearly, we do need to broaden coverage to help the legacy problem as well. We need more people paying into a health care system. Now, the problem with declining industrial businesses is rather unique. You know, there are far fewer workers today, and because people live longer, far more retirees. And those, as I said earlier, are not always the people who are willing to share. You know, they're in the system, they like it the way it is, and while they're theoretically concerned about others, they aren't necessarily willing to make a big contribution in that regard. But it is the industrial companies who have the most at stake here, because they are competing with companies in every major industrialized society who have all their health coverage and most of their pensions off the table. That's not factored into the price of a Toyota. And yet we have to compete with them in Detroit or wherever else we still make cars. So, that was one of the driving forces. The Business Roundtable has always been more inclined to find a solution than the NFIB, which had a very different view of how they wanted to cover their workers. So it's important nationally, economically, that we do this. And if ultimately, Fred, we have to pay for this with a value-added tax, that would also be helpful, because every other country has one but us. That's just a gratuitous thought on my part. Believe me, nobody's talking about it right now. But it wouldn't surprise me when we get serious about deficit reduction. You can only do so much to raise rates on Americans. At some point it just loses its political appeal. And I think it's like we used to build everything with one B-2 bomber. That's the price of one B-2 bomber, and how many times did we spend the B-2 bomber? We now have to kind of realize that we can't just put a surcharge on or another bracket on. At some point, we're all doing it for everything we love because it's politically easy. At some point, Obama's commitment to not raise taxes on people who make $250,000 or less will have to be put in context, shall we say. That was a promise made before the great implosion of last October. The country is in a very different place than it was before. And the needs that we face, the deficits we've run, all of that, I think, requires new thinking. And when you get to have the new thought is the political question. Is it before the midterm elections? Probably not. Yes?
Let's do a couple more questions.
Yeah.
I share your admiration of the courage and the competence of the congressmen and congresswomen, and I wonder if you could elaborate a little more on what you think of the pros and cons of the strategy of the White House has been on health care. Some of us feel that he has done little to lead because he started by saying, you guys do it. That's 435 people, and there's 100 there, and the lobbyists of every industry, and that may not be a good idea. Could you comment on the strategy, the policy, the strategy, and the tactics of the White House, which has a big role in this?
Well, first of all, when Rahm Emanuel was first appointed chief of staff, he came to the Democratic caucus and said, we're going to throw long and we're going to throw deep, and you better catch it. So it was never off the agenda of the White House. They wanted health care. They wanted that to be their first major accomplishment, aside from a stimulus bill. I think they concluded, having watched how Bill Clinton did it, that they wanted to take an entirely different tack. Instead of having, the 100 smartest health policy people in the world get together in one room and come up with a plan that on paper looked like something Rube Goldberg would produce, he said, let's let the Congress, which really never put its oar in the water in '93, as I said earlier, let us know what they can accomplish. There were some very brilliant people like Henry Waxman, whether you like him or not, Max Baucus, who knew an awful lot about health care and knew the politics of their committees and their Senate and House colleagues. I think it's clear that they have perhaps gone a little far in ceding to the Congress, but I think it's still very timely. At some point here, when the two houses have passed what they can pass, and believe me, the fights are now on the very difficult but somewhat peripheral issue of abortion and immigration, et cetera. We're getting down to the hot button issues. Then Obama has to step in and say, here's what we will do, and let's do it. And the problem is the Senate. 60 votes. They're going to be voting on every amendment with 60 votes required to bring it up. Republicans are so intransigent in opposition. They're going to use every trick in the procedural book to prolong this. It could well take the Senate the entire month of December just to get to a point where they could vote on a final passage. So despite all of the promises of Christmas presents, I think it's much more likely now that it might go over. And I don't know there'll even be a conference as much as a kind of ping pong game between the two bodies until they finally get something they can both pass. And I say that Obama will be very crucial at that time. Believe me, they have been engaged. They have been engaged, but not in constant public dialogue. There are so many other things on the president's plate. Everybody is convinced that he's not giving them enough attention. But he's in the media every day giving something attention that needs to be attended to. It's an incredible task. So I think he will be there at the crucial time. And I have to say that unfortunately Tom Daschle's demise complicated the situation. Had he not had to take a pass, unfortunately he did, he would have been able to advance the cause in the Senate, I think, a lot more effectively. And I think the other tragic loss was Ted Kennedy, not just his passing, but his absence. Ted Kennedy was wonderful at negotiating compromises and deals, and the liberal community always understood that if Ted said it was okay, he'd gotten all he could get. It's time to compromise. And he was gone. So he didn't have anybody to replace Daschle's inside knowledge and policy knowledge and Kennedy's political instincts and ability to bring people together across party lines. And in that light, I think they've done okay. And I'm still optimistic it will get done. Yeah.
Thank you, Congressman Fazio, for your years of experience and for sharing it with us. I had a question about the United States Public Health Service and where you saw it characterized in this health policy debate. We don't hear very much about that, but whenever there's an outbreak like H1N1 or pandemic influenza, then suddenly everyone is relying on the United States Public Health Service and all the local affiliates across the country and counties and cities to deal with public health. So I wanted to find out from you how you characterize public health as part of the healthcare reform debate, and then also, do you see it as a cost containment entity in this process of providing health services to people who are uninsured?
Yeah. You know, I think that's a very good point. We've really not talked a lot about public health in the sense of the institutions that look out for it. We're aware of it every night now. I mean, you see the Secretary of Health and Human Services focused almost entirely on H1N1. I have a granddaughter in college in Virginia who's got it. She's sitting in a dorm with everybody in the dorm. I mean, my wife asked me if it was safe to come to the Berkeley campus this week, or is I coming home with swine flu? How am I doing? I don't know, you know? But the bottom line here is we don't pay attention to the public health system until it's a crisis. And there hasn't been a lot of focus on that. But I know that there are people in the administration who would like to do more. And the problem, of course, is that it's largely funded at the state and local level, and the resources are in decline. You know, the money isn't there. These are the kinds of things that counties are having to cut because the state isn't giving them enough money. And it's penny wise and pound foolish when you end up with the health care problems that can affect large swaths of society. I mean, you know, we'd all like to think that everybody going into the emergency room belongs there, is a right to be there, whether you're illegal or undocumented or a citizen or someone in need or what have you. We know the fact is that not everybody gets access, even in the public health system. And yet we're all in the same world together. We're all in the same communities together. Tuberculosis could spread again in our society if we don't limit it in the way in which we deal with people who bring it here from other places. So, I mean, it's a very important point, and I frankly don't think a lot of time and attention has been given to it. That doesn't mean to say it hasn't been, but the good news for you is if it has been, it wasn't controversial, because the only time you hear about anything is if there's a fight about it.
Well, I suspect there are many more of you with questions, but let's stop, and hopefully you'll stick around, help us eat up the food in the back. You can chat with the congressman, and in the meantime, please join me in thanking Congressman Victor H.
Thank you. Thank you very much.